Well, hello and welcome to Rajat TV. You're watching India Fights Back with the host Rajat Kain. Well, it's a show which gets you latest on India and how even the world is preparing against COVID-19 pandemic. However, in this edition of the show, we'll discuss one of the most important aspect of COVID-19 that we need to understand. It is how we have to look ourselves even after a recovery from the virus that is understood to impact our long-term health, as more and more studies are showing. One of them essentially happens to be impact of COVID-19 on the eyesight, although we'll be covering several other aspects of health, but we'll be focusing to begin with on the eyesight. Now, among the impacts it's seen in some cases is that the upper respiratory tract infection can cause irritation of the membrane covering the eyes. In common terminology, this is known as conjunctivitis, or we can have a pink eye, which is fairly, you can say, there's an irritation on the eyes. And given more and more studies are being conducted on the effect of COVID, the experts are especially looking for COVID's impact on the pupil and the iris of our eyes that may affect our eyesight. Well, to discuss more on the aspects of the eyesight and other issues that one needs to look for in the post-COVID recovery, we are joined with Dr. Sudarshan Khokhar. He is Professor of Dr. Rajendra Prasad Center for Ophthalmic Science from AIIMS, and Dr. Sanjay Kumar Bhadada. He is Professor of Endocrinology, PGIMER, Chandigarh. Well, many thanks, gentlemen, for joining us. Let me start with you, Dr. Khokhar. Sir, as we talk of the COVID-19, now the COVID-19 recovery, there are some challenges that we are noticing. Currently, it's still under study. We know it's a new thing, but we are seeing certain complications among the patients or people who have recovered from COVID-19 pandemic. Now, what do you suggest when it comes to COVID-19 pandemic and eye care? How much of our eyesight happens to be vulnerable for those people who are under COVID-19 care and the ones who have already recovered?
I think, Rajat, that's a very good question and has to be addressed properly, because once the disease phase is getting over, how do you want to kickstart your life back to normal?
Right.
Okay, so let me put it directly. I mean, if I have a time, so you can have the impact of the COVID indirectly or directly.
Okay.
Direct impact is, as you said, there's a dryness of the eye, and that is basically because the conjunctival membrane has a layer on which the virus will stay alive. And you can actually spread it from one patient to another through the tear gland. So I think that's very important.
Yes.
So that's how it's connected. So as you said rightly, when it's present there, you can have irritation, you can have a conjunctivitis, which is a plain, simple conjunctivitis, which any virus used to cause earlier. Earlier, we used to get all these conjunctivitis, which were actually adenovirus. Adenovirus has a very short life, and we knew about the nature of this virus. And after 5 to 7 days, it used to die off on its own, and patients used to recover. Here also, in some patients who were immunocompromised and people who are taking steroids for some other systemic disease, and the immunity level was low, we found that in adenovirus also we used to get this, on the cornea we used to have ulcerations and white spots, which used to be called superficial punctate keratitis, which was in adeno also in compromised. But in the present COVID, it's a new disease, nobody knows about it. And we are getting actually patients who are getting the superficial punctate keratitis from begin with. Dryness of the eye. So dryness of the eye, how do you pick up in the patients? So first thing is, person who is a contact lens user will suddenly realize that his contact lenses are not working the same way as they were doing earlier. And they remove it and they put lubricating drops and put glasses, the vision comes back to normal. So that's one, the dryness factor. Especially when there's elderly people, like elderly ladies or gentlemen, in which the hormonal changes have already taken place. Those people, especially the ladies, are more prone for dry eye as such.
Okay.
But with the COVID and the mask on the face and not stepping out, I think it's actually not e to the power X, actually increased exponentially.
Right.
So that's the other group which we have to be very careful.
Right.
Those patients, and if the virus is there, they have to be treated like a conjunctivitis and we try to give little steroid drops more often in these ones so that the inflammation at the conjunctiva is less. But during this
Right.
period, the conjunctivitis is on. These people are a source of infection to other people also. So first thing I talked about is the surface thing, which is a conjunctivitis or dryness, which is on the surface of the eye, which is irritating, and you can pick it up very early. The
Right.
bigger problem which is happening with COVID is the blood starts coagulating more than normal. So all these vessels which are inside, you can have a CRVOs and BR, branch retinal vein occlusion and central retinal vein occlusion. So when the veins inside the eye, which are supplying onto the retina, gets occluded, which is happening quite often now, and that's because of the hypercoagulability of the blood. So that is another thing which can be seen. So any patient during this time who comes with a sudden loss of vision, we have to dilate this and look into the eyes. You can have a sudden loss of vision, you can have a surface irritation, and the third group, which is in which actually it's being forced on the students. All these young kids used to attend the class, and most of the guys used to be sleeping in the class, most probably not looking at the blackboard. Now, because of the screen which is too close to the eyes, and these small screens, when they're looking at the classes, which are going from, I think, from 9 to 4 o'clock, around the clock, 4 hours, when they're playing games or seeing the screens more from the near, their near accommodation goes for a toss. So what happens? All these people who were intermittent divergent squints, meaning they were controlling the squint because of the muscle tone, have now become apparent. Those squints have started becoming up. So we started getting patients who earlier were controlled with exercises might need surgery now to control the squint.
Right.
Fourth group is in which the kids, in which the cataract was very immature, or they're falling up with us, or there was a squint, and in which they were giving patch treatment and which needed treatment. Now, because of the COVID lockdown, they're not able to come to the hospital. Thus, the ability to see with both the eyes is going to go down in the future. So we can come on to that later on if you have any questions.
Yeah,
So
absolutely.
these are the nutshell I've told you.
Well. Well, many thanks for your opening remarks, sir. Let me go off to Dr. Sanjay Kumar Bhadada. He's Professor of Endocrinology from PGIMER, Chandigarh. Dr. Bhadada, I beg your pardon. Many thanks for joining us, sir. Sir, my question is fairly similar to you as well. I mean, in terms of the post-COVID care, I mean, which are the indicators to look for people suffering, or to say, I mean, healthy persons who have just recovered, just for a preliminary understanding, we know that there are issues about fatigue, there are issues about appetite, but which are the ones so far we have come to know perhaps could be the long-term impacts or effects of COVID-19 even after recovery?
Thank you, Rajat. At the outset, first and most important thing is I would like to say is that very dynamic process. So the data is not very widely available on various issues, but
Right.
some of the information is available on various organs, especially with relation to lung, because that is the primary site where the
Yes.
virus attacks. And we are finding people are having lot of persistence of cough even after the recovery, and they are negative for the COVID virus. So chronic cough is one of the problem. And the second problem possibly is that they might be having lung fibrosis.
Okay.
And lung fibrosis because of the secondary inflammation of the lung. And that can be a very, very dangerous situation in the coming time, because it can be a long-term problem, and there is no treatment available as such to improve the pliability of the lung. So which is already, if the fibrosis is there and that is likely, then that will be a problem.
Right.
And then other organ which is of our interest, especially the pancreas.
Yes.
So in pancreas, that found that this virus enters into the human cell by a receptor that is called ACE2, angiotensin converting enzyme 2 receptor, ACE2.
Okay.
And the people have found that these ACE2 receptors are present in many organ systems, and they found that is also found to be in the beta cells of the pancreas. And we know the beta cells of the pancreas are the cells, those are releasing the insulin on demand as required. And when this virus enters into the pancreas through the ACE2 receptor, and that is actually destroying particularly the islet cells, and that is specifically beta cells.
Okay.
And that's why the many patients are not having diabetes with the onset of COVID, but they are diagnosed diabetes during the hospital stay,
Okay.
and in follow-up also people are increasing number of patients are having the diabetes. So that is kind of destroying the beta cells and producing diabetes. Now it can be behavior can be very erratic, like this total beta cell is destroyed, then that can behave like a type 1 diabetes kind of situation.
Okay.
But if beta cell destruction is limited, then they can have the some amount of beta cells, they can behave like a type 2 diabetes where you can be able to manage with the tablets, etc. So with
Right.
relation
Right.
to diabetes, this is there. And then there is an interaction with the some of the drugs those are used in the patients of type 2 diabetes, like ACE inhibitors and angiotensin receptor blockers. But the situation on not very clear, so I'm not talking much on that.
I get your
And
point,
the
sir.
recent
Absolutely.
few studies we have found on the literature that this virus is found alive in the brain in the autopsy. That may be very, very dangerous, and the people are having the problem of forgetfulness, like
Okay.
kind of dementic kind of symptoms
Right.
because
Right.
of the prolonged complication of the COVID-19. So these are the some of the major organ system those are affected.
Right, right, right. Thanks, Dr. Bhadada, to begin with. I'll just come back to you. I have a couple of important questions on the aspect of metabolism as well. Let me go to Sudarshan, Dr. Sudarshan Khokhar here. Sir, I have a very pointed query here that we often gets to encounter when somebody is down with COVID, and this is concerning your discipline, the ophthalmology. So here, what is more susceptible towards getting affected from the virus? Is it like wearing contact lenses or wearing or just doing away with contact lenses and wearing glass? Yeah, I mean the spectacles. So,
Yeah, Rajat, as I mentioned earlier, also, it's a live virus present in the tear secretion. So your tear, wherever the tear goes, if the tear goes to the other patient, it can cause a problem, and especially more for the surgeons. Now, if we're operating this patient, we use things like ultrasonic frequencies inside the eye, so it can actually pulverize and can become aerosol, can spread in the entire OT. So whenever you go to see the patient, I think it's must to wear glasses. Even if you're not having a number, it's best to wear a zero power glasses. I think everybody should wear it as of now. Wearing a mask is one way of protecting it because it doesn't go into the mucosal membrane, but through the eye it can still go. I don't wear glasses otherwise, but when I'm going to the hospital in the OT, I've got glasses which I actually seal it off and do it. And I've been saving myself for the last 8 months. So far, so good. So conjunctiva is an important source and it can actually cause spread. Now, coming to the children I was mentioning, the problem with the children is in children, we need to operate these patients because if we don't operate, they're going to be blind forever and they go amblyoptic. And the second problem is the children will not have too many symptoms of COVID. Even if they're positive, they're not going to show the symptoms.
right,
There was a
right.
study from China, for each child who's less than 5 years of age, you need at least 3 to 4 samples to pick up one positive. That means it's picking up negatives, but it's not coming properly. That means they are like sitting time bombs. So because the immunity is strong, they will not show symptoms. They might have a little running nose here and there with the cold weather.
Right.
You can't make out whether it's COVID or not. But those can spread to the elderly. When this kid goes to meet the grandpa, the moment he hugs the grandpa is at the risk. So
And they're more
it's basically
susceptible as they are aging,
that
right? Yeah.
these guys are like good, rich source of infection, and they will not wear mask. Second thing, the kids will not wear the mask also. When the parents will wear the mask, the children don't wear the mask. And we are dealing with the children. I handle lots of pediatric cataracts, which we operate less than 2-3 years of age. And I've started operating for the last 3 months. For the last 3 months, I've put all my OT at alert because we have to operate. If we don't operate, we're going to lose this patient's vision. So when we operate, I don't allow too many people in my OT. I wear glasses and I stick the stickers all over. Second, what I'm saying is that if you're wearing a mask, it's best to put a sticker on the top of the mask that whatever air you're breathing out should not release out towards the eye. If it goes towards the eye, the patient's eye will get the infection and it can spread further. If we can stop it there, it'll stick to the lung only and won't come to the eye. I think that's one of the precautions which everybody should take. Now, third thing which I was talking is lots of patients are given steroid in this one. So once they give a steroid, the problem is all the, like Dr. Sab had mentioned, the diabetic changes, pancreas, type 1 and type 2 diabetes. We have lots of patients who are diabetic retinopathy. So basically they are non-proliferative, but with the steroid dosage given for high dosage, all these have become severe, meaning that this patient will need laser or surgeries later on, because the proliferation, once it happens in the retina, see, once there's a change because of diabetes, you can have changes in the brain, you can have changes in the eye, you can have changes in the kidney and other systems. And the eye, you can actually go and see and look into the eye and see it without taking any biopsy. So whatever changes are happening in the retina might be the changes which are happening in the other parts of the body. So we suddenly realized that in the last 6 months, the number of patients with diabetic retinopathy have increased in RP center AIIMS. Second, patient with the central retinal vein occlusion and branch retinal vein. So these are the small veins inside the eye which give the supply to the optic nerve and the retina, and these are getting blocked because of the hypercoagulability. So these are the important things, because once, even if the patient has recovered, they can have long-standing loss of vision. They might not recover their vision fully if the retina is involved. Although the surface, conjunctivitis and all these things can be handled well, but the retinal changes, once they take place, cannot be reversed to fully 100%.
Right. I'll come back to you, Dr. Khokhar. Let me go off to Dr. Bhadada. Sir, you just explained about, in your opening remarks, you explained us about the metabolism. Now, elaborating further on the concept, I beg your pardon, on the insulin, sir. Now, if we talk of the metabolism, and especially the concept of, or the biological concept of sleep digestion, and we have seen that several patients have a disturbed sleeping patterns. So, is it also a long-term impact, or would you still count it as just a short-term thing, and possibly in a long term it may just get back to normal? Is it something that we should be worried about?
Yeah, I think it's a very Rajatji, very naive question, that it will persist or it will not persist. It will be very difficult to answer to be. But what I can speculate is that first of all, I think first is the stress. The patient is recovered from the COVID, but lot of patients are worried about the complications I mentioned about the diabetes. And recently we found some of the patients are actually dying because of the cardiac illness. Even they are recovered completely from the COVID, but now they are dying of sudden onset of cardiac illness, myocardial infarction, this like that. So it is always in their back of mind, there is always a worry that there's something will happen. And I'm sure to have a good sleep, the most important thing is your the mind at the peace. So that is one of the reasons. And then we have found in our institute the study that a lot of endocrine changes have been documented in these patients. Indeed, almost every gland is affected with the COVID-19, not only the pancreas, but people are observed the effect on the parathyroid gland. They observed the effect on the thyroid gland, that people are developing thyroiditis. People are developing the hypocalcemia. And we have recently published a hypocalcemia paper that patient is having low calcium level. And of course, that calcium level is not that severe that patient is requiring calcium supplementation. But that is known that is causing hypocalcemia, not that severe. So that is affecting the parathyroid gland. They're affecting thyroid gland. So, and all these hormones play a very, very important role, or their secretion is very regulated in 24 hours. Like most of the hormones are secreted in the night time, are secreted early morning time, and few are completely absent, or it is, you can say, level is very, very low in the when they are going to bed, something like that. But say because of stress, their level of hormones remained elevated, then their sleep disturbance is more likely. And like melatonin is one of the hormone that takes care of the sleep wake cycle.
Okay.
So because of these hormones, if the melatonin cycle go haywire, then obviously that likely the problem to have the sleep problem might persist for some time. And then associated, you are telling in your opening statement that chronic fatigue So
Yes,
that is also
yes.
very, very common, and it is very well recognized that chronic fatigue syndrome associated with COVID-19, and that is causing lot of problems. So if person is fatigued, is stressed, then sleep will further deteriorated because of that also.
Right, right. That's very important point that chronic fatigue is actually resultant
Yeah.
of that clear resultant of coronavirus may lead to some other issues
Yes.
as well. Dr. Khokhar, to you, very simple question here. We have seen that in terms the patient who are diabetic, they often suffer with diabetic eye disease. That is very common complication in diabetes. So somebody who is at the same time suffering or down with coronavirus, what sort of the risk he or she runs into when they're already diabetic in that case?
Yeah,
How much
Rajat,
they should be worried about their, the eyesight for that matter, or what all precautions are required for them, especially for the eyesight when they're diabetic as well as down with corona? Sir.
yeah, sure. So, as such, diabetes is a leading cause of blindness world over. In USA, I think majority of the people go blind because of the diabetes. And what happens is because of the diabetes, there's a proliferation of the new vessels inside the eye, and these vessels are so weak that they start bleeding very often, right? So the injection, we give injection inside the eye, which are called anti-VEGFs. We want to growth retarding hormone injections in the eye. But the effect lasts for a couple of weeks, or 4 to 6 weeks, maximum a month, 2 months. So there are new medicines which are coming. So they have to keep injecting into the eye, into the vitreous, intravitreal injections. So all these diabetic patients who were non-proliferative will turn into proliferative diabetic retinopathy because of, as Dr. West mentioned, that because of the lack of insulin, the sugar was so high that they actually start behaving like IDDMs, like insulin-dependent type 1 diabetic. And those retinopathies, once they start, you can just delay it. You can't stop the blindness. So
Okay.
what happens?
Okay.
You give injection, the anti-VEGF effect will stay for 2 months, 3 months. Now the new medicines come like Eylea and all those, which it can stay for 5 to 6 months. But that is not the actual answer. The answer is that you need to have medicines which are not available right now to control the diabetic retinopathy, first thing.
Okay.
So control of diabetes is the only thing which was in the hand of the patient, which was actually delaying all these retinopathies. And with this COVID coming into the picture, and steroids coming in, all the anxiety, as Dr. Will mentioned, the anxiety actually causes so much issues. So diabetic retinopathies are actually gone really into a spiral and really gone bad now. The second thing I was mentioning was all these computer vision syndrome is the one in which you're watching computer for a longer period. For adult, it's fine. He is already his muscles are all developed up. For the pediatric age group, when they actually are being forced, I would like to, through your media, would like to suggest that all these teachers who are putting tasks to the students through computers should reduce it. See, they're getting the salary because all the schools are still charging the full fees from the parents, maybe a little more now. So what is happening, just to show that they're doing the classes, they should do the classes, but they have to be a systematic manner. Earlier in the classroom, whatever you're teaching on the blackboard cannot be replicated onto the computer 100%. You
Right.
have to
Right.
make it pictorial, video related, and to compress the thing, not to go all the way like they were doing on the blackboard. Screens are not blackboards, and blackboard at the
Yeah.
distance you keep blinking your eyes and you can get up and walk around and move. People are starting getting neck problems. They started getting spondylitis. All these kids actually started getting squints now. That's the problem which we're facing, and especially all these students who actually need to be checking their glasses every 6 months because of the COVID. They haven't come, so they're using the old glasses. So because of that, they get more strains, so more headaches. And these
Right.
headaches are
Right.
because of the virus, conjunctive, what we actually don't know. So I think till the system comes back into the entire back onto
Normalcy.
the
Right.
same wheels, you have to make sure that all these students keep doing the relaxing exercises. So what are those exercises? When you're watching the computer, maybe for 1 hour or two, and then you just cover your eyes.
Okay. Okay. That's fairly
Couple of
easy.
funny
Right. Right.
exercises, break the accommodation. So you break the accommodation chain. If you don't break that, patient will start getting headaches and they might get nausea also. All these some
Okay.
people have bad sleep also because of that. So I think we should teach them, but teach them properly, methodically, and online teaching cannot be the copy from the blackboard straight away.
That's true. That's true. That's very important. Yeah, Dr. Khokhar, that's extremely important. Just, I'm sorry, we're just short on time. So let me just go off to Dr. Sanjay Kumar Bhadada for just closing remarks. Sir, so very simple question, rather, I would say very oversimplified question. Given the kind of dangers, or for that matter, I would say precautions you mentioned one should be careful about, the persons who are down with COVID and even the ones who have recovered from COVID, which age group in particular you would suggest needs to be very careful in terms of indicators like fatigue, sleep deprivation, and of course, metabolism issues? Which age group happens to be the most vulnerable one?
Well, Rajatji, again, I'll say that first of all, it depends on what kind of disease they are going to have. Like cardiac problems, more likely to be the elderly population because they are already at risk. And recently, I was talking to one of my collaborator from the Atlanta University at Emory University, Atlanta, and they are telling that the mortality because of post-COVID cardiac is so high. Especially those are having some element of cardiac. So adult patients should be monitored carefully for their cardiac issues. Young kids, as already mentioned, sir was mentioned, Dr. Khokhar, is that related to their concentration, maybe their eye issues, something like that. And but chronic fatigue syndrome is common in almost all kinds of all age groups. So everybody should be be careful for that. And one more thing I want to say is that
please.
Endocrine hormones like PTH, ACTH, they have very structural similarity with this virus. And that's where they are destroying the endocrine glands. And the endocrine gland destruction is a very slow process. So when they are discharged from the hospital, they have just minor changes in their hormone levels. But maybe after 3 months, they have their same changes progress and they will convert into their florid manifestations. So they should carefully look for their all hormonal profile at the end of 3 months and 6 months subsequently.
Right. Well, many thanks, Dr. Sanjay Kumar Bhadada, and many thanks, Dr. Sudarshan Khokhar, for elucidating on this extremely important subject and just telling us what one should do, especially in terms of the post-COVID care. Well, many thanks to our viewers for joining us. But before we leave, here is a small appeal from RSTV. Well, small things you can do to defeat coronavirus pandemic: keep wearing a face mask, wash hands, and maintain physical distance. 6 feet at least, that's what I recommend if possible. Now, these are 3 things that can be done easily to defeat the pandemic. Stay safe. Keep watching Rajat TV. Thank you.